There's something weird going on with health insurance. For years, we've been promised that soon it will be
affordable.
But in 2025, the average cost of health insurance for a family was $27,000, which is crazy. I mean, you could buy a new car for that much. And that's before you even use your insurance. That's just the cost to have an insurance card mailed to you. The real question is, what can we do about this? Because the truth is, there are some real practical things that we can all do right now to dramatically reduce the cost that we pay for healthcare. Now, this all starts with a very simple idea, which is just that you should try to keep health insurance out of as much of your healthcare as possible. And there are a lot of reasons for this, but the biggest is that health insurance isn't actually real insurance. The whole idea of insurance is to pay a low monthly cost to insure yourself against the potential of a large but unlikely risk. So this is why home insurance will pay to replace a roof, but not a light bulb. Now, health insurance works in exactly the opposite way. You pay a very high monthly cost for something that covers even the smallest expenses like flu shots and generic medications. That is no longer insurance. It is simply prepaid medical care. So this is super important to understand. 75 years ago, health insurance worked just like every other kind of insurance. It was there for the very large medical bills and that's it. But over time, it has mutated into something entirely different. So now it covers basically all of your healthcare expenses, large and small. Now, you might say, hey, is that such a bad thing? It sounds kind of nice to have more stuff covered. But the truth is that this is definitely not ideal for a number of reasons. For one, you're not prepaying for just your medical care. You're prepaying for everyone's medical care and then splitting the bill evenly. And the problem is that model only makes sense for large, rare, unexpected events, things that are largely outside of your control. Sharing cost like that for smaller expenses just incentivizes high utilization and penalizes those who are actually trying to be responsible. But it's even worse than that. Not only are you prepaying for everyone's medical care and then splitting the bill evenly, the cost of that care is also inflated far beyond what it should be. This is now verifiably true. Insurance negotiated rates are worse than rates you could get without insurance for the exact same care. We know this because in 2021, hospitals were required to make their pricing publicly available. And as they started to all publish their pricing data, it became very clear that the cash pay rate was often half the cost of the insurance negotiated rate for the exact same procedure at the exact same hospital. So that means you are paying an expensive insurance premium every single month for the privilege of then paying twice as much when you actually need care. And this doesn't just apply to large hospital expenses. Call any local specialist or primary care physician in your city. Most of them give massive discounts to self-pay patients. This is one of the best kept secrets in healthcare. Insurance networks are not getting you access to better pricing. They're actually doing the exact opposite. So you can see why you would want to keep health insurance out of your healthcare. It's not even real insurance, it's prepaid medical care that incentivizes high utilization, but only with the doctors they want you to see and at rates that are twice as expensive as what you could get on your own. Now, what are you supposed to do with this information? Just go entirely uninsured? Pay cash for everything? Well, you could, but most people are probably still going to want some sort of catastrophic coverage for the really big bad medical bills. So the perfect arrangement starts to look something like pay cash for everything you can afford, which is going to be most of your healthcare expenses most years, and then still keep an over-the-top coverage with a very low monthly cost, just in case you ever get hit with a very large medical bill. All right, so maybe that all makes sense in theory, but let's take a look at how it holds up in the real world. Let's take an average family of 4, give them a very good gold plan with low copays, low deductible, and an annual premium that is still under that $27,000 average. So between their copays and premium payments, they'll spend just about $23,000 in a year with typical healthcare usage. Now let's give them an alternate plan which doesn't cover any routine out-of-pocket expenses and is only there for emergencies. Even with paying full price for all of their expenses, the total annual cost is still less than half of the gold plan. And that's with me assuming that these guys are not savvy healthcare shoppers, and so all of their cash prices are on the higher end of what's likely. Now, what if this family did have a large emergency this year? Let's say a $50,000 medical bill. Well, they'd pay the $2,000 deductible on their gold plan, or the $5,000 on the catastrophic plan, which would still leave the catastrophic plan coming in $10,000 cheaper. So when I say that traditional health insurance, the way that most people use it, is almost never a good deal, I actually really mean it. And the numbers on this are solid. You can run these numbers for a young single person, for someone who has a chronic condition like diabetes, for an aging couple with knee replacements on the horizon. The numbers consistently work out in favor of keeping insurance on the sidelines and paying cash for as much of your healthcare as you can. I know this goes against the status quo, and people are gonna be mad. They're gonna say that this is dangerous advice and that it's irresponsible. But just look around. Remember that the average cost to insure a family of 4 is $27,000. The status quo is clearly not working very well. And most people will readily agree that the current approach is broken. They're just unwilling to consider alternatives. I don't know if it's just because the insurance propaganda runs super deep, or why it is that people are so hesitant to venture outside of the very system that they hate. But if you are one of the few who is willing to consider that maybe the way you've been doing things isn't the only way to do things, and that perhaps there is a more sensible way to pay for healthcare, I think you'll be pleasantly surprised when you run these numbers for yourself. So with all of that being said, remember, health insurance is not insurance. It's prepaid medical care, where you split an artificially inflated bill equally with everyone, regardless of how much of that care you consumed. It is better to pay directly for as much of your healthcare as you can afford and save insurance for just the big bad bills only. If you would like to learn more about how to better pay for healthcare directly, that's exactly why we started commoncare.org. We help employers set up simple health plans that allow their employees to pay for out-of-pocket medical, dental, and vision expenses on a pre-tax basis. That alone will already save you 20 or 30% on your healthcare expenses. And then we also have advanced analysis tools, both for individuals and employers, to help you find the best catastrophic options that will cover you for the things that you need, but not force you to pay extra for the things that you don't. Most people are shocked that they're able to find individual options for between $100 and $200 a month, and family options for between $300 and $400 a month. So, if any of that sounds interesting to you, head on over to commoncare.org to see what life looks like beyond insurance.